Thanks for coming back. In this video, we will be discussing one of the most common discomforts in pregnancy, and that is nausea and vomiting. We will cover a few different takeaways, including why nausea and vomiting occur, treating yourself for symptoms, and treatment options your provider may suggest. Many women will experience some nausea in pregnancy, and about 1/3 of all women will have nausea severe enough to interfere with your daily life. Nausea and any vomiting that occurs is worse usually in the first 8 to 10 weeks after your first missed menstrual period, and most women no longer feel nauseous by weeks 12 to 16. This nausea that comes with pregnancy is often called morning sickness, but most women are nauseous at different times of the day and night. We don't particularly know what exactly causes the nausea, but we suspect that the rapid change in hormones play a part. If you experience nausea when taking birth control pills, you might be more likely to have nausea during pregnancy. Nausea becomes worse when a mother is dehydrated from not drinking enough fluids, or if they have low blood sugar from not eating in a while. Nausea in pregnancy might feel pretty awful, but it's usually not dangerous to you or your baby. However, a very small percentage of women will have nausea and vomiting so bad that they are unable to eat or drink anything and need to be seen by their provider for treatment as soon as possible. Also, if you know you are pregnant but you don't have nausea, congratulations. There's nothing wrong with that and no cause for concern at all. It is a common symptom, but each woman is different, and your body just handles these hormones differently than others. Unfortunately, the only cure for nausea and vomiting in pregnancy is to wait it out. But there are different things you can do to make yourself more comfortable in the meantime. Stick to foods that you want to eat now, even if that's the same food over and over again. Also, avoid eating, seeing, thinking about, and most importantly, smelling any foods that trigger nausea. Because pregnant women have a stronger sense of smell in pregnancy, make sure your family members also avoid cooking or eating the foods that make you the most nauseous if you smell them. Every woman is different, so what appeals to you is going to be different than what appealed to your girlfriends, sisters, or mothers. That's okay. Eat what you want to eat, and when you don't feel like eating anymore, switch it up. Find a new food that appeals to you. Speaking of eating, nausea is most likely to hit you when you haven't eaten in a while. Many women find morning nausea easier to manage if they have to have a snack close by, right by their bed to nibble on before they get going in the morning. Trail mix, dry cereal are good options and might help you feel a little better first thing in the morning. And you should also eat during the day to help keep the nausea away. For some women, that means snacking frequently on fruits, nuts, or granola, while others try to eat 6 smaller meals instead of 3 large meals throughout the day. Whatever best works for you and your lifestyle. Also, make sure to keep well hydrated and drink enough fluids. Sometimes water is not appealing when you're nauseous, so try sucking on popsicles, drinking cold juice, or eating fruits with lots of water like melons or oranges. And eat healthy. It's definitely something hard to do when you're pregnant, but greasy fried foods or foods high in fat tend to trigger more nausea. Simple foods that aren't too processed like cheese and crackers or toast with peanut butter and fresh fruit are great options. There are a few natural treatments that actually work well to treat nausea in pregnancy, and these include ginger. Even smelling ginger can sometimes help with nausea. If you want to eat ginger, just make sure that you check the label on your foods to make sure that's actually ginger, not just ginger flavoring. There are tons of ginger candies, ginger drinks, and ginger teas that can really help some women. Other women prefer the smell and taste of lemons to ward off nausea. Sour candies, lemon tea, or even the smell of fresh lemons can work wonders for a lot of women. C-band bracelets are another option, and they work really well for some mothers. A C-band is an elastic wristlet that puts pressure on this acupressure point in the inside of the wrist. They can be found in most drugstores, and they're cheap, they're easy to use, and they have really no side effects. If your nausea is not relieved by these strategies, talk with your provider about potential medication. There's a few FDA-approved medications to treat nausea in pregnancy. However, it's important to note that don't take any medication unless it's been approved by your provider, as some are not safe in pregnancy. And that's about it on nausea. Thank you for watching.